Welcome to NTN Nightly. I am Janelle Norville. This edition's top stories. The Ministry of Health strengthens the healthcare system to effectively manage the island's fourth wave. The Prime Minister of St. Lucia calls for increased collaboration between Africa and the Caribbean. And the Holy Family Children's Home receives a large monetary donation. The Ministry of Health, Wellness and Elderly Affairs on Wednesday held a press briefing providing the nation with an update on St. Lucia's COVID-19 situation. The country has recorded an increase in COVID-19 cases and is currently experiencing its fourth wave. The increase in cases has piqued concern as to St. Lucia's ability to effectively manage this fourth wave. Medical Director of the Respiratory Hospital, Dr. Alicia Eugene Ford, provided insight into the current standing of the island's primary COVID-19 care facility. The Medical Director indicated that the Respiratory Hospital has a bed capacity of 123, 15 of which are in the Intensive Care Unit ICU. The ICU manages critical and severe COVID-19 cases.
Majority of the cases they come in with comorbidities. So in addition to the oxygen therapy that we give them, the antibiotic therapy, the chest or lung rehabilitation, we have to treat them for the other comorbidities, whether it be hypertension, diabetes, and all other complications, sickle cell disease and cancer, etc. So we have to treat them from the other illnesses as well.
Dr. Eugene Ford noted that from February 2021 to date, the hospital has recorded 1,460 admissions, 20 of which were fully vaccinated. As of September 8, 2021, after a thorough verification process, the deaths of 2 fully vaccinated individuals have been recorded. These individuals suffered from underlying conditions. The management of the respiratory hospital has adopted new protocols to improve patient care and comfort. This includes a new visitation policy.
We would allow these individuals, their family member, their husband or their partner to come in and see the baby and mommy. We also have persons who are critical or we know they actually have a terminal illness. We would allow these individuals to come in and see their family members, which is different from what happened in the first few waves. We have a drop-off service that we've started where we allow persons to drop off items for their family members who are admitted. We allow for the logging and the verification of these items and sanitation. So staff members are assigned to take these items and bring them to the different wards.
Dr. Eugene Ford encouraged the family members utilizing the drop-off service at the hospital to avoid bulky, unnecessary items. Other measures enacted by the respiratory hospital include bolstering the staff contingent, improved communication systems, viewing of the body of deceased patients at the respiratory hospital's morgue and outpatient clinics. The Chief Medical Officer speaking at Wednesday's press briefing disclosed that data from the wave and contact tracing process guides the measures, protocols and recommendations emanating from the Ministry of Health, Wellness and Elderly Affairs. This, Dr. Sharon Belmar-George explained, is done with the view of keeping the population safe and curbing the spread of the virus. She added that due to the nature of the pandemic, it is difficult to forecast the long term. Consequently, once a risk has been identified, changes often occur with short notice, as quick and decisive action is necessary to mitigate that risk.
If we note a new risk from the cases we are getting, we will not wait for the 3 weeks to pass to make a new recommendation. As much as possible, we try to mitigate those risks, and it does lead to a level of inconvenience to the public, which we recognize. So we use the data from the contact tracing to see where the cases are coming from, to identify the risk, and we target our interventions guided by this data.
Dr. Belmar-George added that based on data stemming from St. Lucia's fourth wave, recommendations made during the first and second waves may not be applicable to this wave. Providing an example, the Chief Medical Officer explained why at this stage in St. Lucia's management of COVID-19, recommendations may not include the closure of the borders.
From our data coming in, we monitor the number of positive cases that are coming from the hotel. We also do contact tracing. We have on testing staff members at the hotels from positive guests. we have not been able to show that there are cases coming in from guests and a spread to the staff when we test them. We do not have any information showing that. When we test the staff that were in contact with the guests, we are not getting spread from the hotels. Another factor that we have to look at, we have been monitoring the immunization rates of visitors coming in. In the month of June, 63% of the visitors were fully vaccinated. In July, it was 71%. In August, 74% of visitors coming in are fully vaccinated. We also look at the vaccinated rates at the hotels. The hotels have been the services that have the highest rates of vaccination of staff members. A lot of the hotels, up to 75 to 85% of the officers there, the workers are fully vaccinated. So there's an extra protective level coming in.
The Chief Medical Officer highlighted measures that would aid in curbing the spread of COVID-19 in country.
In trying to facilitate a level of balance, we use the data to guide, to mitigate the risks. The point where we are now and what we know works are the adherence to the public health measures that we see and we note can and does keep us safe when it is implemented in a proper way. The other measure is the adequate vaccine coverage in country that we are working on various levels to see how we can increase that level so that we can get a reduction of persons coming in to our healthcare system and also see a reduction in the number of deaths as well.
Chief Medical Officer Dr. Sharon Belmar George. Meantime, the Prime Minister of St. Lucia is calling for increased collaboration between Africa and the Caribbean in tackling issues plaguing the two territories, such as COVID-19. The statement came as Prime Minister Honorable Philip J. Pierre addressed the first Africa CARICOM Summit held virtually under the theme Unity Across Continents and Oceans, Opportunities for Deepening Integration.
My administration also welcomes this ready platform for communication, cooperation, coordination between Africa and the Caribbean to share COVID-19 experiences and develop mechanisms to help reduce our common dependence on equal vaccine distribution. This is a stark living reminder of the inequalities of the system. Having to import 10 times more pharmaceuticals than we produce in the Caribbean, and our regional vaccination levels at only between 15 and 23%. We also support the recent initiative announced by PAO to create a platform to increase regional vaccine manufacturing and production.
The Prime Minister stated that unity is critical in building climate resilience between Africa and the Caribbean region, as both territories are vulnerable to the devastation of climate change.
This means that inevitably, we are all invested in securing sustained global action to arrest and reverse this scourge. In this regard, close cooperation between small and developing states, African countries and other developing states was instrumental in securing the 2015 Paris Agreement and the 1.5 target for global temperature increase. In light of the climate emergency, the pursuit of a green recovery from the COVID-19 pandemic, and the critical decisions to be made at the 26th Conference of Parties to the United Nations Framework Convention on Climate Change, COP26, it is essential that the flame of collaboration kindled in Paris be fanned vigorously in Glasgow in November of this year.
Prime Minister Honorable Philip J. Pierre added that the regions must maximize possibilities for collaboration outside of international arrangements. He explained that the regions can explore areas of technology, capacity building, research exchanges, and education, to name a few. The Department of Agriculture and Sustainable Development have joined forces to launch the Building Resilience or Adaptation to Climate Change and Climate Variability in Agriculture in St. Lucia project. This project is funded by the Adaptation Fund and implemented by the Caribbean Development Bank. Anicia Antoine reports.
St. Lucia, like many other small island developing states, is highly vulnerable to natural disasters due to its geography, location, climate, and geology. The Building Resilience or Adaptation to Climate Change and Climate Variability in Agriculture in St. Lucia project aims to improve the resilience of rural farm communities by increasing farm productivity, water and livelihood security, and reducing vulnerability to natural hazards, climate variability, and climate change. The project's targets include interventions for water security, soil conservation and management, the integration of renewable energy practices to increase efficiency, and knowledge management and transfer to improve adaptive capacities. Minister for Agriculture, Fisheries, Rural Development and Food Security, Honorable Alfred Prosper, says in the face of more frequent and severe agricultural losses, such as the recent impact of Hurricane Elsa, and farmers having little to no insurance coverage, developing a resilient agricultural sector is critical.
Noticeably, the project seeks to build on existing efforts, soil and slope stabilization being done by the Forestry Department under the John Compton Dam project and the IW Eco project in areas of Millet and Fonsejac, respectively. Also targeted are water conservation measures to complement some of the work that are currently ongoing with respect to rainwater harvesting initiatives, increasing water storage capacity, and enhancement of irrigation systems under the 7 Crops project and the Banana Productivity Improvement project. I wish to express, on behalf of the government of St. Lucia, sincere appreciation to the Adaptation Fund, especially to the board and all those involved in the approval process who ensured that St. Lucia was able to secure this grant.
The Department of Sustainable Development is the designated national authority responsible for maintaining communication between the funding agency, the Adaptation Fund, and the implementing agency, the Caribbean Development Bank. Minister with responsibility for sustainable development, Honorable Sean Edward, expressed gratitude to the agencies for making resources available to support St. Lucia's agricultural resilience efforts.
Indeed, the launch of this project is being done at a time when St. Lucia must demonstrate its fortitude as a country as we find ways to recover from the COVID-19 pandemic, which has eaten away at the economic, social, and cultural landscapes. We have confidence that this project will provide meaningful and sustainable benefits to the farmers and community members in the 5 agriculture regions in which it will be rolled out, and by extension to the economy of St. Lucia at large.
The cost of the Building Resilience or Adaptation to Climate Change and Climate Variability in Agriculture project in St. Lucia is estimated to be $9.1 million. From the Communications Unit of the Ministry of Agriculture, I am Anicia Antoine reporting.
The Ministry of External Affairs, International Trade, Civil Aviation and Diaspora Affairs has facilitated a sizable monetary contribution from a St. Lucian in the regional diaspora to the Holy Family Children's Home in St. Lucia. This presentation represents the 3rd large donation towards a special cause by individuals in the diaspora in 2021. More in this report from Glenn Simon.
How do we give back?
The Ministry of External Affairs, International Trade, Civil Aviation and Diaspora Affairs facilitated a monetary donation to the Holy Family Children's Home from St. Lucian-born Marjorie Dussel Zephyrin, now resident in Martinique. Martha Pierre, who made the presentation on behalf of Marjorie Dussel, said her cousin was born in the town of Soufrière to Enos and Julia Calix and has been considering for quite some time now how she could contribute to the country of her birth.
She sought the assistance of the consul in Martinique, Ms. Joanna Sultan, to determine the most effective way and meaningful way as well that she could contribute to the welfare of children in St. Lucia. It is on her behalf that I, as the oldest relative residing here, makes this presentation of EC $30,000 to Sister Antonia David.
Administrator of the Holy Family Children's Home, Sister Antonia David, expressed her gratitude for this timely donation, which will greatly assist the home in molding productive citizens of St. Lucia.
it's difficult for persons everywhere. And to come to the point of choosing to give back to St. Lucia and to give to children. And I often tell people, these are the persons who will be taking care of us tomorrow. So they will be the ones sitting here in the not so far future as the ministers and the doctors and nurses and, doing exactly what Madame Duchel is doing. So we are very grateful for this opportunity. Thank you, Madame Duchel, and your friends and family.
Ambassador for Diaspora Affairs, Joycelyn Fletcher, recognized the importance of the diaspora to national development and said that this was the third individual in the diaspora who has made such large contributions in 2021.
You have just again proven my point about the diaspora, how important they are and what they do. And it has been the mantra of this office since it was set up 2 years ago, to ensure that St. Lucia knows what our diaspora are doing and that our diaspora are very, very important people and that they're important to the social and economic development of St. Lucia.
Madame Dussel was visibly pleased that her contribution had gone to service the needs of the children of the Holy Family Children's Home. Via Zoom connection, she applauded the managers of the home for the wonderful work they have been doing.
When you said about youngsters, I thought they were teenagers. But when I saw the pictures and I saw the young children and so on, I was very impressed. And I think I have been loving them from then. So I'm very glad of that idea. She chose that group. So I thank everyone who was in charge because we could not be there personally to do all what we had to do. But then everything has been done, and I thank all my family.
The check presentation was held in the conference room of the Ministry of External Affairs, in the presence of the Minister for External Affairs, Honorable Alva Baptiste, other senior members of staff, and family members of Marjorie Dussel Zephyrin. For the National Competitiveness and Productivity Council, Glenn Simon reporting.
This is NTN Nightly. Primus Hutchinson is up next. Stay with us.
Breast milk is the gold standard that cannot be emulated. It is the perfect food for your baby.
Breast milk provides antibodies and protective factors which may fight against COVID-19 should your baby be exposed.
Breastfeeding reduces the risk for premenopausal, breast and ovarian cancers.
Breastfeeding is the most natural way to feed your baby. Breast milk provides all the nutrients your baby needs for the first 6 months of life. It requires patience. However, your baby deserves the best and it's worth the effort.
Breastfeeding a baby up to 12 months improves jawbone development, thereby reducing misalignment of the teeth.
Breast milk is baby's first immunization. It protects against viruses, bacteria, and also prevents some chronic diseases.
If your child becomes sick with any illness, including COVID-19, it is very important that you continue breastfeeding.
A woman with COVID-19 should be supported to breastfeed her baby safely, hold her newborn skin to skin, and share a room with her baby.
After giving your baby only breast milk for the first 6 months of life, you can now slowly start introducing solid foods at the right textures. These include pureed vegetables, fruits, peas, and healthy cereals.
For more information, call the Nutrition Unit of the Ministry of Health and Wellness at 468-5359.
Welcome back. We join Primus Hutchinson for the NTN Nouvelle à Creole.
Merci autant, Janelle. C'est Madame le département qui a une responsabilité pour information en gouvernement cette télévision nationale pays NTN Capuzato Nouvelle Creole Primus
Ministre de Santé, et qu'a fait les plus grands citoyens à cette partie, honorable Moses Jean-Baptiste, moi temps pour remercier tous les officiers et les individus et professionnels qui sont engagés en bataille contre la maladie corona. Expressement, quand le mot maladie ça a augmenté, et quasiment urgence. Mercredi bon matin, le 8e jour en mois de septembre 2021, trois grands grecs docteurs au ministère de la Santé qui sont engagés pour la bataille contre la maladie corona, chef officier médical en cette Dr. Sharon Belma George, Dr. Michel François et Dr. Alicia Eugene Ford, qui est responsable pour l'hôpital Victoria. C'est une grande discussion face au public à la télévision NTN expliquée par les journalistes qui étaient présents et aussi ceux qui étaient suivre à la télévision et Internet. C'est des marches-là qui sont en place pour adresser effectivement la situation de la maladie corona en pays présentement. Le ministre de la Santé, honorable Moses Jean-Baptiste, qui a adressé cette discussion par technologie Zoom et Internet, remercier tous ces Grecs-là qui ont gommé contre la maladie COVID-19 et corona, qui ont immergé tellement en cette ici. Mais il mentionnait principalement ces personnes qui sont sorties pour chercher et faire investigation concernant la quantité de monde qui a été la maladie, ça l'a immergé. Ça, c'est contact tracers. Mais le ministre Jean-Baptiste parlait dit effort gouvernement et le ministère a fait dans ces mois et chaque semaine depuis le gouvernement ça là.
Ça nous a fait, c'est nous avons regardé ces différents divers, ça nous a fait en affaires santé pour aider expressément l'hôpital Victoria parce que nous savons c'est là les gens qui sont bien malades, c'est là qu'ils peuvent aller pour jouer un traitement. Et avec ça nous a fait, c'est nous a fait conditions primaires pour les gens qui sont malades jouer assistance par un programme nous avons créé Patient Welfare Assistance. Ça veut dire que les gens qui travaillent Victoria à présent pour aider des situations. Avec le programme ça là, nous avons mené aussi à l'hôpital Saint-Jude avec un autre hôpital qui est en pays ici. Nous avons aussi dit que nous avons travaillé pour eux, que nous avons mis plus de monde, nous avons créé contact tracer. Ça veut dire que c'est les gens qui travaillent pour garder qui côté les gens qui ont besoin d'aider, peut-être les gens qui viennent en contact avec les gens qui ont COVID. Qui maintenant nous savons ça, c'est en anglais nous avons créé contact tracers avec nous avons mis plus contact tracers en travail pour aider des situations. Aussi en l'hôpital Victoria, nous avons un frère excès qui docteur qui sorti de Cuba avec eux à présent, ils ont enregistré avec eux qui travaillent à l'hôpital à présent pour aider des situations. Avec ça nous avons c'est plus de monde qui prend vaccin avec vaccin ça nous avons créé en anglais vaccination rate. Ça veut dire combien de monde en grande quantité en simple ici qui apprennent vaccin. Avec nos cas qui, depuis 5 semaines passées, vaccination rate, ça a monté par 2%. C'était 14%, à présent, c'est 16%. Comme ça, nous avons encouragé tout le monde pour continuer pour vacciner. Malheureusement, il s'est cassé chez nous pour tant au matin, Dr. Eugene dit nous comme ça, il y a des gens qui ne sont pas vaccinés qui doivent passer.
En parlant de ça, le docteur qui est responsable pour l'hôpital Victoria, Alicia Eugene Ford, déclare que depuis le mois de février pour à présent, il y a 1460 personnes qui ont entré à l'hôpital Victoria pour traitement. Et parmi eux, c'est seulement 20 qui sont déjà vaccinés.
Et puis c'est 20 personnes, nous avons des gens nous savent qui mort. Le mot dit mort, nous just pas just report mort quoi. Nous pouvons ces gens nous pouvons chat yo, nous pouvons délai nous pouvons faire couper yo, nous pouvons délai nous espérer famille mener ID card là tout ça, il y a un process. Nous pouvons faire. Il charge, il sait pas quitter nous faire depuis nous un monde qui mort nous ca report li. À présent, il y a un changement en manière nous pouvons faire. Et puis, il pas qu'à sortir un news là, just go ha. OK? So, ça, c'est après les gens morts, nous avons 20 gens qui étaient vaccinés en 1400 hospitals depuis février. Mais à tous ces gens qui 20 gens qui étaient vaccinés, nous déquimons et puis nous avons just report à ces gens ça parce que nous savons nous report à ces gens qui morts. Nous pour passer pour le process pour faire chai avant la venir sur radio ou ti pour la population cette ici qui nous un monde qui mort Covid.
Eh bien, nous avons pour information, c'est une discussion ça là et que réponse au docteur Eugene Ford et ministre de santé honorable Moses Baptiste à ce présentation. Premier ministre c'est honorable Philippe J. Pierre trouvé une visitation par un ministre gouvernement de l'Angleterre. Ça c'est honorable Anne-Marie Trevelyan. Honorable Trevelyan c'est ministre qui a responsabilité énergie et changement de climat. Ministre gouvernement de l'Angleterre a tenu une discussion concernant le projet de changement de climat qui s'est implémenté par support gouvernement du pays de l'Angleterre pour aider à renforcer la capacité du pays à adresser cette changement de climat. Il y a plus haut en façon de coopération des projets des affaires économiques façon de construction, par exemple, projet Grand Chemin Millennium et Grand Chemin Col de Sac pour Sophie. Ça, c'est des projets qui ont augmenté l'économie du pays là, et qui réduit à ce quantité de temps pour voyager à ce système social là, et pour bâtir résilience des climats à ce chemin. Le Premier ministre là aussi discuté l'autre projet de coopération touristique, bâtiment de résilience des climats, réduction en crime et économie des affaires générales. Quand l'administration un nouveau salaire a essayé de ménager l'économie cette année, expressément en bas pèse corona, le ministre de l'Angleterre a ce dernier la route pour 8 jours adressé assistance des finances pour ce pays Caraïbes là, pour pas seulement faire bataille contre les désastres, mais aussi bâtir résilience contre le climat. Le gouvernement cette a participé à une conférence qui a été à Glasgow pour se trouver projet de transformation en bas gouvernement nouveau. Mesdames, c'est côté nous pour nouvelle là. Quand merci autant pour regarder pour avoir une invitation pour moi pour studier. Vous savez la vie, et nous présente nouvelle. Oui, on la présente. La vie présente.
Merci Apple Primus. We now take a look at the weather.
Sunrise Thursday, 5:52 a.m. Winds will be blowing from the east near 16 miles per hour or 26 kilometers per hour. The weather is fair to partly cloudy skies with a few brief showers. Seas are slight to moderate with waves 3 to 5 feet or 0.9 to 1.5 meters. Fair skies will become cloudy at times with a few scattered showers and possibly thunderstorms over the southern Windward Islands and areas further south. Elsewhere, fair to partly cloudy skies with a few showers. A tropical wave will cause a few cloudy periods with showers and possibly thunderstorms mainly over the southern portion of the region during the next 24 hours. Two other tropical waves located over the central and far eastern tropic Atlantic are moving westward near 12 miles per hour or 19 kilometers per hour.
That brings us to the end of NTN Nightly. Join us next time at 7 p.m. with a repeat at 7 a.m. You can also catch up with us anytime on the St. Lucia Government Facebook page or YouTube channel. I am Janelle Norville.